Hi guys, so I'm first going to start off with this video of my brother describing some of the side effects that could be associated with this drug.
Oh, dang, my head hurts. I can't go to bed.
So as you can see, he has an ice pack on his leg, presenting that his leg is injured or swollen, and then he has a headache and he can't fall asleep. So any ideas of what this drug may be? And the correct answer is stanozolol. This is the chemical name for stanozolol that I'm not going to try to pronounce. And then the chemical formula is C21H32N2O. Some brand names for this drug is Winstrol, which is the most common, Minable, Neurable, Stanol, Stromboject. And then some street names is Stromboject, Winstrol V, Winstrol Depot, Winstrol, Neurable Capsules, Stromba, Estazole, Minable, Tevabolin, Stanol, Dragon, Pharma, Winstrol, Cetabon, and Winstroid. So this is a synthetic steroid that is derived from testosterone. It has anabolic and androgenic properties. It is classified as a Schedule 3 drug and it is legal, but you must have a prescription for it in the US. And then it is often screened in urine tests for athletes because one of the most frequent users of this steroid is professional athletes and young adults. And then it was first synthesized in 1959 and it came to the US market in 1962, but is quickly withdrawn from the US market in 2010 after changes with the FDA regulations. And then the color of this drug is white or almost white, and the tablets can be different colors like pink or orange though. And then this is just the chemical makeup of the drug and the chemical structure. So the first question is what scheduled drug is stanozolol? A schedule 1, B schedule 2, C schedule 3, D schedule 4. And the correct answer for this is schedule 3. And then question 2 is when did stanozolol get taken off the US market? A 1962, B 2000, C 1990, D 2010. And correct answer for this is D 2010. So it was first banned by the International Olympic Committee and the International Amateur Athletic Federation in 1974. But then a few years after that, in 1988, a Canadian sprinter, Ben Johnson, tested positive for the steroid, and he was stripped of his gold medal in the 100 meters. And then under the 2015 World Anti-Doping Code, Olympic and Paralympic athletes who test positive for this drug can potentially face up to a 4-year ban from their sport for an intentional violation. So, stanozolol can be administered orally or injected, so it can be taken by a tablet or injected through the muscular tissue, and then it usually takes effect within 1 to 2 hours. And then here I have a picture of some tablets and then also it being injected. So, you're supposed to inject 2 milligrams of stanozolol 3 times a day, usually with meals, and then 1 month supply is about $60 to $70. However, it's cheaper to buy overseas, but you risk getting in legal trouble and shipping is more expensive. So this steroid is cycling, which means that a person takes it for a certain amount of weeks and then either has off weeks or low doses. This helps reduce tolerance levels, reduce adverse effects, prevent detection of steroid use, and ensure peak performance during competition. So cycling periods last from 6 to 16 weeks, but for stanozolol, it's usually 10 weeks. So humans use this drug to treat aplastic anemia, hereditary angioedema, vascular disorders, and growth failures, which is all positives of this drug, and you can obtain it with a prescription from a doctor. And then it's usually used mostly by athletes for lean muscles, fat loss, weightlifting, and performance. And then it's mostly used by males. And then vets also use this steroid often to treat animals in weight loss, anemia, and poor appetite, and it's mostly used in dogs. So, question 3, Stanozolol can be injected in any part of the body. And that is false. It can only be injected through the muscular tissue. And then question 4, Stanozolol does have medical purposes, and that is true, and that is why it is still legal in the US. And then this is just a quick video that shows some positive and negative effects of stanozolol use that I found helpful that I'm going to show. So as you can see, this steroid does have positive effects and also some negative effects. So some side effects of using stanozolol is swelling in the arms or legs, which was seen in the video, and then worse acne, difficulty sleeping, and headaches, which was also seen in the video, changes in sexual desire, and then in males, frequent or persistent erections and breast tenderness or enlargement, and then in females, voice changes, hair loss, facial hair growth, and menstrual irregularities. And then some risks are heart attack, strokes, liver damages, and psychiatric disturbances, which could be mood swings, impaired judgment, depression, nervousness, irritability, delusions, and aggression. And then some major diseases that this steroid can cause is carcinoma in males, fluid retention, hypercalcemia in breast cancer, hyperlipoproteinemia, liver diseases, polycythemia, suppression of clotting features, diabetes, thyroid function, HIV, and hepatitis. So, question 5, what is not a side effect of stanozolol use? A, stroke, B, clear skin, C, breast tenderness, D, voice changes. And the correct answer for this is B, clear skin. This steroid causes acne. And then question 6, what gender is steroid use most common in? A, males, B, females, C, both equally. And the correct answer for this is A, males. So this is just a table showing anabolic and androgenic steroids in 2017 and if they're used singly or in combination. As you can see, stanozol is right here, and it is more used in combination with other drugs, which is a major problem, which I'm going to show on the next slide. Um, so these are the major drugs it interacts with. And for the most part, when it interacts with these drugs, it causes more bleeding, blood clots, and increases risk to liver problems and liver damages. So it's really scary that this steroid is used more in combination because of all these increased problems that a person may have because of that. So this is just a table also done in 2017 that shows anabolic use between 8th, 10th, and 12th graders. And as you can see, 12th graders use anabolic steroids more often than 8th or 10th graders. But it did drop down in 2016 and it was at its peak in 2015. Um, a reason for this may be this is the age group that looks up to athletes and may want to go into college athlete and play a sport in college. So this is them like testing out the steroids and seeing all of that stuff for themselves. So some statistics about steroids among teens, 40% 40% of teens society use steroids based on what professional athletes do. And then more than 40% of teens say it is easy to obtain steroids without a prescription. 57% of teens feel like they need to take steroids to improve their body after looking at magazines and television. And then 15% of teen athletes try to educate themselves about steroids. And that last statistic is really scary to me because athletes are the ones that use the steroids and they don't want to know more about them. And as we saw in the previous slides, these steroids can cause major problems, especially mixed and in combination with other medications. So I definitely think we need to bring more awareness to teens because this is the age they start doing it. So, question 7, where can someone buy Stanozolol? A, black market, B, with a prescription, C, online, D, all of the above. And the correct answer for this is D, all of the above. With a prescription for medical reasons, it's very easy to obtain a steroid, and then the black market and online is also very accessible for people who want this steroid. And then, what age group is Stanozolol used most common in? A, young adults, B, middle age, C, teens, D, all ages. The correct answer for this is young adults because these are the college age students and the those getting into a professional sport is during this group, the young adult age. Although teens do have that's when they start using it. Um, More young adults use it than teens. And then these are my references.